My name is Chris Ford. I am a graduate of the College of Business Administration, 1973. You might be asking yourself, what's he doing hanging out with all these people from Bouvé? And Joe and I have a mutual friend who got me involved with the program. So today we're talking about entrepreneurial opportunities in healthcare reform. And I think that, if you read the newspapers or watch what's going on, to paraphrase Charles Dickens, this is the best of times and this is the worst of times in healthcare. And with the healthcare reform going on, there's a lot of issues that are out there. There's some things that have already been cast in one direction, but I think you'll see over the next several years those things will go in different directions. So today we want to try to point out to you some of those opportunities. Before we begin, let me just tell you a little story to try to frame, I think, where we are in the United States healthcare system, and tell you a little story. And the story goes that a guy who is enrolled in Medicare Part D walks up to a high roller in a casino, and he asks the guy, "Could you help me? My wife is very sick. She needs medicine that I can't afford. I'm in the middle of my donut hole. And just $200, please, that's all I need." So the high roller looks at him and he says, "That's a sad story, buddy." He said, "But how do I know you're not going to gamble with that $200? The guy looks back at him, he says, "No, you don't understand. I got gambling money. I just need the money for the drugs." That's a joke. It's a joke, but probably a true story. But I think, from my view, of being around the healthcare system for quite a while, although that's a little jest there, one of the problems is the way I think consumers look at their healthcare dollars. And, gambling money might come before money for your Part D drugs. But the change is going to go on over the next several years, I think, will be not only in the form of the way the government pays for it, the way that payers fund different care, but also the way citizens look at their health care and the way they deal with that. And until I think the consumer gets involved, we're not going to get the changes that we're looking for. Now, today we have a very esteemed group of panelists. I think that you'll be impressed with their backgrounds and their knowledge in this area. And we hope that they can give you some ideas and some thoughts to take away from today. And I will say, when we get to the question and answer session, I encourage you to ask questions as much as you like. Down to the far end of the table here is Don Dempsey. Don is the Senior Vice President of the Marwood Group. The Marwood Group is a healthcare consulting firm, very well respected in Washington circles. They provide advice to investors, private equity firms, and the like. And Don joined Marwood in 2008 as a senior team leader. He's responsible for the firm's coverage of CMS and HHS. He was, prior to that, the Associate Director for Human Resource for Office of Management and Budget. Prior to that, he was a Legislative Director for Senator Richard Burr. And prior to that, he was a Legislative Assistant for the Office of Senator John Kyle. He received his Bachelor Arts degree from Christian Brothers University and a Master's degree in Economics from George Mason University. Next on our panel in the middle is Karen Nelson, Senior Vice President of Clinical Affairs at the Massachusetts Hospital Association. She has over 20 years' experience in the hospital leadership area. She earned a Bachelor of Science in Nursing degree at St. Joseph College and a Master's in Public Administration at Suffolk University School of Management. And prior to the Mass Health Association, Karen was the Executive Director for Clinical Compliance and Risk Management at Brigham and Women's, and had nursing positions at Dana-Farber and the Medical University of South Carolina. The final member of the panel is Evan Felchuk, President and Chief Operating Officer of a company called Best Doctors. Best Doctors gives people access to the best minds in medicine so they have confidence to make informed choices. A pretty interesting company. Evan joined Best Doctors in 1999, and he's held various positions at Best Doctors, including General Counsel from 1994 to 1999. He was an attorney at Fried, Frank, Harris, Shriver, and Jacobson in Washington. He's a graduate of Lehigh University with a JD in the University of Pennsylvania. Now, each one of the panelists are going to give you a little bit of an overview of where they think the healthcare change is right now, a little bit about themselves, and once they conclude that, we'll go to questions and answers.